Hi everybody, just thought I'd give you a further update regards to my nan. Yesterday she had mental capacity because I obviously checked it. Today, the only way I can explain it is today is she was just mumbling different words, different sentences, didn't make no sense at all. She was just waffling on. It sounded like she was drunk. I know she wasn't drunk, but she was talking in riddles and it was just all mumbled up. It was all jumbled up, is the only way I can explain it. And she was making no sense. She was very confused. So, obviously, the lady said she clearly hasn't got mental capacity today. So, that's where I am with that at the moment. Let me get my notes up. She was on 2 lots of antibiotics. She's completed one of them. She's still on another course of antibiotics, but I don't know when she finishes them because I haven't had a chance to speak to the doctor, which I'll find out tomorrow. Blood sugars are low. They've paused her insulin because she's diabetic. And if it does rise to a 12 and above, they can give her a fast-acting insulin pen to bring it down if they need to. They mentioned behaviour charts. Behaviour charts are observational tools used to record and triggers, nature and consequences of challenging patient behaviours. They help staff understand unmet needs, e.g. pain, fear, by mapping actions to identify patterns. These charts are crucial for developing personal care plans. Also, they mentioned about something called discharge to assess, DTA. DTA or something, they said. I asked them the abbreviation, it means discharge to assess. Is an NHS initiative that moves patients out of acute hospital beds as soon as they are clinically stable to recover at home or short-term placements. This home first approach reduces hospital acquired infections and deconditioning, ensuring long-term care needs are assessed in the patient's own environment. The process, once medical treatment is finished, patients are moved to their home or temporary bed where they receive short-term support and assessment by a team of professionals. So basically, if my nan's got mental capacity, about that, if I find it, can't find it, about the discharge to assess, I've been told it's not a care home. It's like in a care home, but in a setting, something about discharge to assess where she's not actually in a care home. It's in a care home setting, but it's not a care home. I can't explain it. It's called something called discharge to assess, where they'll assess my nan's needs to see if she's quite safe to go home. It could be a couple of days, couple of weeks, just to assess her needs to see if she can manage at home when the carers are not there, because they're only there for 4 calls a day. So I said to the ward sister, when my nan's struggling to get on and off the bed, normally she's quite capable, she still needs an assistance. So what concerns me, if she goes home and she's discharged, obviously there's no plans yet, is she can't get on and off the bed. If the carers come at, say, I don't know, 7:30, 8:30 in the morning, so they come and then they're not coming till 12, 12:30, example. What's Nan going to do in that time if she can't get on and off the bed without assistance and the carers are not there for another couple of hours or more? So that's where I've got concerns. But they did say if my nan's got mental capacity and Nan doesn't agree to it, unfortunately, that has to be her choice. That's her right. She's got the capacity to make that decision. If she hasn't, then obviously that's a different ball game. But because my nan's got dementia, her capacity, it's fluctuating, it's going up and down. And because obviously she got dementia, she got an infection and delirium, which is a combination of both dementia and obviously she got an infection that's going to cause confusion. So they are going to assess it tomorrow and do another mental capacity. They can do it as many times as they want. So that's all I can tell you in regards to that at the moment. But if she has got mental capacity and they ask her and they say this, where they can assess her, It's like in a care setting. It's not a care home. I can't explain it better than that. I'm still trying to get my head around it. They can assess her whether if she's safe. Then they can be thinking after that. If none agrees to it, then I'll send her to this whatever thing that I just mentioned to you. I can't remember that. Looking at my notes again, and then they can assess her needs. And then they can decide whether, okay, she's not safe at home, or she's okay, she understands, she's quite safe at home. We've observed her, we've watched her. But if Nan doesn't agree to it, and they ask her tomorrow, and that's her right, that's her choice too. If she understands and she says no, I don't want it, obviously there's not much I can do. They have to respect my Nan's decision. And if she's got capacity and she says no, unfortunately, there's nothing I can do. This is what I mean about people that I know, personally or not. People think, oh, she's not looking after herself. Oh, she's creating dangers. Oh, shove her in a care home. It doesn't work like that, unfortunately. Because, a lot of people, some people do understand, but some people think it's just, oh, she's unsafe. She can't do this, that, and the other. Oh, we got to put her in a care home. It doesn't work like that. If someone's got capacity, now I'll explain about mental capacity. If they tell my Nan something and she can retain it long enough to understand and process it, then she has capacity. If she can't process it and doesn't understand it, then obviously she hasn't got capacity. So if they said, oh, Nan, if you had a fall, what would you do? I'd call the emergency services, or I'd press my pendant. And they asked her 10 minutes afterwards or half an hour afterwards, she could retain it and she still understood it and knew what the person told her. That means she'd have mental capacity. If she couldn't, that would be a different ball game, because you clearly can't retain it and understand it and obviously what it means. This is what I mean. And the Mental Capacity Act is so complex, I can't even get my head around it. I can only explain the basics, so for people to understand, because it is a minefield, it really is. But I've had to learn fast and quick at my own pace. So it's not just as easy as just going, I'm going to put someone at home, they're unsafe, this, that and the other. It doesn't work like that, unfortunately. But yeah, that's the further update with Nan. I won't know any more till tomorrow, but I will keep you posted when I know more, and that's where I am at this stage. Her legs are bad, so they look infected again. Before I left, they were waiting, the hospital, I've got that photographers, they keep taking pictures of her legs to keep an eye on it. To be honest, I'm not a medical professional, but it looks worse than it was. And I've been taking pictures off my own phone, so it is looking bad, but I'm not a medical expert. But when I go to the hospital tomorrow, I'll ask them some more questions. But yeah, that's the only update I've got at the moment. And I'll keep you posted when I know any more. Thanks for listening.